My name's Richard Gunderman. I'm a faculty member at Indiana University's School of Medicine, and I'm also a pediatric radiologist. But what I want to talk with you about today is not radiology in the usual sense. Detecting lesions and offering differential diagnoses, performing imaging-guided procedures, stuff like that. I want to talk to you about a problem that I think is bigger than any particular field in medicine. It's bigger than pediatrics or medicine, surgery, radiology, and so on. And that problem is the impaired physician. Now you might ask yourself, what do you mean by the impaired physician? If I stay up for 36 hours straight, I sometimes feel pretty impaired. That's obviously not exactly what I have in mind. I'm really thinking about physicians who say are involved in substance use, or perhaps who are, let's say, afflicted with mental illnesses of various kinds. The subject is bigger than that, but for the moment, let's focus on those two. So I talked about substance abuse. When we think about the kind of substances that could impair physicians, it's perhaps no surprise to you to learn that the single most common substance that physicians might be using is alcohol. But close to that is, for example, opioids. Physicians probably have roughly the same rate of use of alcohol and problems with alcoholism that we see in the general population. As you might imagine, physicians, and in particular some groups of physicians, I'll give as an example, anesthesiologists are more likely than the general population to develop use problems and addictions with drugs like opioids. And I think that's for pretty obvious reasons. Physicians have the power to prescribe those medications, and physicians also have an unusually high degree of access to those medications. Now, these are really important issues. Of course, alcoholism has been with us for a very long time. The opioid use epidemic is a more recent phenomenon, and it's been driven in part, I think, by the medical profession. Somewhere around the 1990s, and for good reasons, we determined that pain is the fifth vital sign, and that we need to make sure all our patients are assessed and adequately treated for pain they may be experiencing. Unfortunately, we began to use drugs in some cases that we used to use only for, say, patients with widely metastatic tumors to the skeleton. We began to use those same drugs for perhaps less serious problems, such as back pain. And now, in the United States, we have what's often called an opioid epidemic. So one issue is substance use. I don't have time to talk about all the signs of substance abuse or use, the diagnostic criteria, but I think we all have a pretty good idea of what those might be. Another area of impairment for physicians is mental illness. And you think of things like depression and bipolar disorder. Not surprisingly, people susceptible to depression and bipolar disorder are in medicine. They're bright people, but they deal with some of the same mental health issues as the rest of the population. And it's important for us as physicians not to think just of our patients and their families, but to recognize that our colleagues may be dealing with some of the same substance use and impairment issues as our patients, and even more difficult to recognize that we ourselves may sometimes confront the same challenges. One of the problems, I think, for physicians in general is, we often have on our white coats and maybe a stethoscope draped around our neck, and we develop this notion that we are somehow invincible or invulnerable, right? Yeah, substance use, that's the kind of thing that happens to people who aren't quite as bright or quite as self-disciplined as I am. Or mental illness, oh yeah, I know that happens to other people, but it could never happen to me. One of the critical chasms we need to cross as a profession is to recognize that we ourselves are no less vulnerable, no less susceptible to these kinds of problems than our patients. And I think one of the shining challenges to physicians today is to recognize our shared responsibility for our colleagues, for our practices, our medical staff organizations. We are responsible to one another, answerable to one another, to our profession, and to our society, to make sure that patients are not placed at risk because a physician is impaired. As physicians, we can often do a very good job of hiding these things, right? Alcohol use, opioid use, mental illness. We're smart. We know what the symptoms of these disorders are, and we know how to keep them under wraps or concealed. So it may be, in some cases, especially difficult to recognize that a colleague is dealing with these kind of problems, but that in no way excuses us. It doesn't absolve us of the responsibility for looking out for each other. And I really mean that. We're not just here to make diagnoses. We're actually here to look out for each other. Not just to recognize when a colleague is suffering and then summoning in, the substance use police or experts in mental illness, that we ourselves have relationships with our colleagues that can often play an important part in helping people, A, to recognize that they may have a serious problem, and B, to take the steps to beginning to correct it. It doesn't matter how clearly we see the problems an impaired colleague is wrestling with. That impaired colleague needs to see them. And many of us in medicine lack the expertise to handle this kind of situation ourselves, but happily, many hospital medical staffs, health systems, certainly county and state medical societies have individuals who are experts in physicians' health and know how to handle interventions that may sometimes be required to get a colleague to recognize they have a problem and also respond effectively to it. That is one of the defining characteristics of a profession. Not just that we police our own ranks, so to speak, but again, that we're actually looking out for each other. Now, I want to tell you a story about one of the founders of Alcoholics Anonymous. Bill and Dr. Bob are the two people often credited with founding AA. Well, Bill, who tried a long time to stop drinking, finally reached a point where he told his wife, dear, I just don't think I can do this. I don't think I can stop drinking, but I'll tell you what I might be able to do. I'm going to pick a friend and devote my life for the next 6 months to helping that person stop drinking. So Bill did exactly what he said. He got in touch with his friend, worked very hard to help that individual stop drinking. At the end of 6 months, Bill sat down with his wife again and he said, honey, I've worked at this for 6 straight months and I've got to tell you, I've failed. My friend is drinking again. According to the story, Bill's wife looked at him and said, you're right. You weren't able to get your friend to stop drinking, but for the first time in a very long time, you yourself have remained sober. What's the point of that story? The point of that story, I think, is simply this. One of the best ways we help ourselves is to try to help someone else. As long as we're thinking about only ourselves, maybe even curved in on ourselves. I'm my entire sphere of concern. We're not likely to be successful. But when we reach out to others and try to make a difference in their lives, very often that turns out to be the thing that makes the biggest difference in our own. And that's the way I'd encourage you to think about the impaired physician. We have a professional responsibility to protect our patients and communities from impaired colleagues. But more importantly, We have a professional responsibility to look out for each other, to work not only with, but for each other, recognizing that if we have this kind of a community where we're looking out for each other, we're ultimately going to make the profession of medicine stronger. And I think that's one of the important lessons of the impaired physician. It's not just a matter of recognizing a disorder and treating it, it's that we all take responsibility. We're in this together. None of us can be stronger than each of us. And when we think in those terms, I think it actually helps us to become not only better doctors, but better human beings. Thanks very much.